today I'd like to talk about needles and cannulas used in facial aesthetics treatments. It's a common fear that people have. They're worried that it will hurt, or they want to have treatment or contemplating having treatment, but they don't like needles and they're scared because it could be something that they've experienced in the past, or they've seen other people go through hospital procedures that have involved needles or cannulas, or you yourself might have had those experiences. It's not like having a blood test. They're completely different needles and cannulas that are used, and I'd like to show you what I use in my treatments to help allay some of those fears. So the first one I'd like to show you is a very fine diabetic needle that I use to inject muscles, and that will help to relax the skin overlying it and hence soften the lines, be it in the frown, forehead, sides of the eyes, or any other muscles where we want to improve the skin on top, and those muscles are very active that are causing the puckering or the lines in the skin. So as you can see, they're very, very fine. It's what diabetics use every day, so it's comfortable. And not all of the whole depth of that needle needs to go in certain muscles anyway. So that's very comfortable. With regards to fillers, I'm going to open up what I use for fillers. And again, your safety, your cross-infection control is important. So all the needles used are sterile. And again, this can be used for fillers. I'll just show you that. Again, they're very fine, and depending on which area we're treating, again, the whole depth of that needle does not need to go in. Cannulas are actually blunt needles. I'll show you these. This is what a cannula looks like. So you can see it's very, very fine, very, very thin, not like what is used in certain hospital procedures. And the great thing about these cannulas is they're flexible as well. So they help to minimize any bruising or swelling that you may get as well. And again, that is injected, in fact, that is actually, inserted following a very fine pinpoint hole that goes into the skin to allow for the entry of the cannula. Again, with needles, you can have very minimal bruising as well. My manner in which I inject is very gentle, so I'm very safe because I consider the anatomy, obviously, of any blood vessels and nerves, etc. And I take my time. So it's really, really important that all these treatments can be done very safe, very effectively, very gently, with minimal pain, with a healthcare trained professional. So I've been doing this now. I'm an aesthetics doctor, having done this now for 20 years. And I have treated thousands of patients who come back for either repeat procedures, later on in time, in months, or for other procedures. So people wouldn't come back if it hurt. So hopefully that has helped to allay any concerns or fears you may have. And if you have any questions at all, then please do ask me in the comments below. I hope that helps.